public health and land use and transportation planning just never happened. It was an unnatural act. And when the topic, in my experience, would come up at various venues, some people just sort of rolled their eyes or made fun of the notion of why would those disciplines be talking together. And I just think it's important that we mark this kind of a moment because it really shows how quickly things can evolve. It's easy to get sort of disappointed about how slow some things seem to go in our society, but this is a fast-moving paradigm. And to me, as I was looking at your slides, the slide of sponsors that had on one row the Federal Reserve Bank and Walk Sacramento on the same slide sort of epitomizes to me this wonderful new set of players who are coming together for joint purpose here. So I want to work with our panelists here to dive a little deeply into how this happened and some additional thoughts on what it means. So Dr. Kasiri, if you could just talk a little bit more about why this collaboration at the county happened and what are the headline issues that you think mark how things will be different in the county going forward compared to if these two departments had stayed in their separate silos.
Thank you, Mike. And just to give a little bit of history and background on public health and the importance of us being involved in the built environment. For a long time in public health, we've talked about the burden of chronic disease in our communities. We've talked about obesity and the increasing rates of obesity in the community. And our focus had always been on talking about the behaviors, talking about lack of exercise and lack of good nutrition as the main driving points for why we were seeing higher and higher rates of obesity. But and of course, because of that, our focus had always been on, talking about solutions, our focus had always been on behavior, telling people about why they needed to exercise, telling them that they needed to eat 5 servings of fruits and vegetables and so on and so forth. And I remember a couple of times when I gave presentations and after I talk about the data and show them what was happening from 10 years back, I always had this sense that people really felt like discouraged and dismayed that they really didn't know what they could do to change the trends. But slowly there came this, I could call it maybe a paradigm shift in public health, where there was the realization that the environment that people were in actually determined the kind of choices they made and therefore determined their health. And so there was this thought of, okay, we needed to look at the environment. We needed to improve the environment so that we could make the healthy choice, basically the easy choice. And so in public health, and this was happening not just in Sacramento, but in other areas as well, we started looking at, okay, how do we start playing a role in how the environment is built and playing a role in the communities and making sure that public health and the choices that people are able to make are part of the decisions that are made. And so when I started as health officer, one of the first meetings I had, I was introduced to Judy Robinson, and at that initially I didn't even know where this would go. I just thought, okay, you know, she works in a totally different area, and, you know, I didn't even know where, you know, our collaboration would go. But as Judy had mentioned, just taking advantage of opportunities that came up, I was invited to participate in some projects that she was working on in encouraging people to use parks, and that led to one thing after another, and then, of course, led to the project that we started working on. And what I see as what is going to, the change that occurred for public health, one is having an active collaboration with other members that we don't traditionally think of as public health, and being able to reach out to people in planning and actually learning their language as well as teaching them our language, because as you know, in public health we use a lot of, one of the things Judy mentioned, social determinants of health. Sometimes you tell people about that and they're like, well, what are you talking about? So being able to have common terms that we can use, learning each other's language, and together looking for opportunities where we can collaborate, and not just two people, but actually bringing in other people with their expertise, because the team we had different levels of expertise, and everyone had something that they could bring to the table, and we all had a common goal, which was to improve the health of the public. So that really helped, and what I see moving forward is us being able to continue looking for opportunities where we can work together, and also engaging our policymakers. Judy mentioned that we did approach Supervisor Cerner, and he was very gracious in agreeing to, support what we were doing, and he's continued to do that. So being able to reach out to the policymakers and making them think about public health whenever different projects come up to them. So I think that's a place where we're going to see more activity, and of course bringing more people, engaging more people, engaging the public in the things that we are doing.
Let me ask a follow-up question before we dive into the community engagement issue. Julia mentioned at the outset a book called Stretching Community Dollars, which another lifetime ago I was involved in creating, and that was also about creating partnerships. In that case, it was between cities and counties and school districts. And we did a lot of research around the state on best practices and who was really excelling at that. And one of the sort of common sense learnings out of that was that the areas that are really practicing that collaboration full on have made it part of their culture. And when the representative from the city or the county or the school district, when they show up to work in the morning, they're just acting like there's a partnership there, like they're almost like they're part of the same department, and they often become personal friends and they develop relationships. And it's not just something that you go to meet once a month and check in and compare notes. It's part of their daily existence. Guys, let me throw this to both Judy and the doctor. Are you seeing that kind of a culture and a bond forming at the county as a result of this? And if you want to talk about your road trip, go ahead.
You enjoyed that way too much. I want to really give credit to Walk Sacramento and the cross-sector team designed for Active Sacramento that really is the foundation and the glue for all of this. Because it was there where, and when people talk about successful collaborations, it's the relationship part. That's the part that keeps people connected and together and honest and real. And that's what embeds the value and the benefits, that roll out as a result of it. None of us ever looked at this as, this is just part of the job. It was like, oh, I get to do this and I get paid for it. Isn't that cool? But yeah, when one of the slides, it was, if you really want to get to know somebody, take a road trip. And our team really wants to do another road trip, but we need to find somebody else to pay for it. But the story that we were sharing earlier was when our team was assembled and we were going to a national convening in Atlanta and to meet all the other teams, and so we wanted to go a day early so that we could go see and visit Savannah. So we flew into Atlanta, rented a van, and we all piled in the van, and Olivia was sleep deprived, so she went all the way in the back of the van and fell asleep. And Monica and I got to drive, and Adrian was our navigator. And one of the first stops was breakfast because we took a red eye out of Sacramento, and so Olivia goes to the bathroom and we're all talking amongst each other. What do we order? Are we gonna really experience Southern food, or are we gonna try to be healthy? And we said, bag the health part. We're in the South. We're gonna be eating all this food. And so the road trip created those stories and created those memories. And then we were headed, after visiting with Savannah, we spent the night, we were headed back to Atlanta, and somehow got sidetracked and ended up in South Carolina. And about that time, Olivia wakes up in the way back seat of the van. She goes, "What are we doing in South Carolina?" And so it's the best part of that. We get to tell stories and laugh at each other, and that's the relationship that was forged. And that was relationship and the honesty that we had going through and dealing with all of our projects, and as we go into the project and the challenges and how do we deal with that. And Monica was there. Olivia, I mean, yeah, you want to jump in?
I think that the value of that is prior to that trip, we were all kind of just getting to know one another, and we're still observing each other in our professional roles. But what that did is actually it acted like an icebreaker and allowed us to actually become more comfortable talking to each other and, being more free in our communication. A lot of people, maybe the way that they do it if they're not able to go for a trip is a retreat, because that's basically what you're trying to do there, is to get out of your normal environment, spend quality time together, and actually break down those the professional barriers so that you can actually work more closely together, and it provides the opportunity for networking.
If I can add on to that, I think the benefit resulted, and it kind of alluded to your question, Mike, of being able to have a broader set of resources. So all of a sudden, not only did I have a public health officer to call directly for a reference in one county, I had a group of resources if I was working in another county to kind of collaborate and strategize with. So it really opened up and broadened the partnerships and problem solving around health in the built environment. We all came with different stakeholders and different relationships from our jobs. So it really just allowed the health and planning conversation to be dispersed broadly and quickly in our region.
So why don't you, Monica, follow up with that and just talk about the people outside of government and what their role in this, the importance of community engagement is, and how it affected the trajectory of this good work.
Certainly, thanks. So Olivia alluded to this, but this group had been working informally with each other as early as 2012, 2011. And, Olivia is the primary care physician for every resident in Sacramento County. So she came with a lot of stakeholders, and we had each built strong relationships prior to coming together. So as we worked through this policy process, we had on the ground people that we could test and get feedback from on the direction around health in the built environment. And so when the county got to the place where they were adopting guidance, they had just an overwhelming amount of nonprofit groups and residents coming in to say, yes, please adopt this. This represents the communities that we want to have, and we understand that where we're living now is impacting us negatively or positively, and it's helping to give a voice and a more common language for residents who may not have been engaged in planning. Planning essentially was a public health field when it started, right? We wanted to separate the unhealthy land uses from our communities. Mm-hmm. And I think, our work today can argue that we've made some mistakes along the way, and now we're going to learn from them. And in this learning, we're really bringing along and we're building community knowledge, which then just gives a voice to residents to tell their own story, and we're really the partner in that storytelling.
Do you see the partnerships that are coming from the grassroots level expanding in the future? Have we arrived at where we need to be, or is there more room for growth there?
I think there will always be room for growth, but we have absolutely expanded the conversation. We are reaching people who, are immigrants, who young people. The California Endowment has been mentioned, the Health Education Council. They're working with young people, helping them to understand and give a voice. And I think it's, incumbent upon us as the policymakers or the local staff to facilitate those conversations, to listen to them, because as much as we have all of our technical expertise and background, the real experts are the people living in those communities, and we can always learn from them.
Right.
Something to kind of build on that too is a challenge to bring private sector healthcare to the table and be part of this conversation. And I think that's one of the positive things that Dr. Zussman and Dr. Hauser, both private sector physicians, have brought to the team in opening up that part of the conversation to really see how healthcare has a piece in the community. Kaiser's been very successful in doing that, but not many of the others have really followed. And so making those connections, really bringing the doctor's office into the community that humanizes. Dr. Hauser did a presentation on why I was a doctor here and did that to a whole room full of planning council members, and to really explain the intersections of all we can do is write prescriptions, by and large. What you can do is really change the land use and the quality of communities so that my patients can really live a healthy quality of life. And Dr. Zussman making those connections as a neurosurgeon,
right,
and seeing the future of healthcare and ways that healthcare really needs to be at a community scale,
right.
Was also an important connection.
Dr. Kasiri, you mentioned that the planners and the public health officials need to learn each other's language. Could ring a bell with me because as I think of the trajectory of this issue at the regional scale, SACOG is a confederation of 22 cities and 6 counties. We have a 31-person member board that are mayors and city council people, county supervisors from around the region. And much of transportation and land use planning you could describe as physical planning. And we look at lots of maps and we look at pictures of roads and light rail lines and streetcars and houses of different kind, multifamily for rental and single family on large lots and for condos for people to buy. And the language we have historically used has been very antiseptic. It's like we talk about drivers and residents and tenants, and the language of people has not yet been in that vocabulary, and I see that changing. And I think one of the reasons it's changing is a movement like this, because the public health officials are at the opposite end of that spectrum, right? Your job is people and making people healthy, and it seems sort of obvious to say it, but when you start using that language when you're in the physical planning business, it changes how you look at things. Right. And you're not, it's dehumanizing to talk about drivers as opposed to people who are using their car to do some things, and then you can talk about people who might want to walk to do some things and bike to do some things and take a train or a bus to do some things. So that's just a little marker in my mind that there is change afoot here. Things are starting to evolve in this area. Judy, where does this go next? You're sort of the head honcho of this. You're the soul of this effort. So where are we going with this?
Well, we have been saying we're building it while we're flying it.
Right.
To some degree, we still are, and our success has really been with leveraging opportunities and leveraging partners. And, with institutes of local governments, local government commissions, the American Planning Association, and now, the Public Health Association, they've all been involved in some of these different efforts that takes our, we've been doing in Sacramento, and then they take that work to Central California or the coast or other parts of the state. And so it continues to grow, and then it comes back, and then we continue to leverage that. And what's exciting is with the American Planning Association, they're offering great support, to Walk Sacramento and through the Plan for Health program. So we've been able to leverage that with some of the convenings that we've had. ILG is continuing to do that with the California Endowment, and again, we're working with the California Conference of Local Health Officers and helping to inform a convening that they're planning on doing in September, and again, similar messaging as this, kind of permeates the state. I mean, on the surface, we've got 7 public health officers that want to get involved with the household travel survey that SACOG is doing. They're adamant they want to be involved, and so they've been reaching out to actually get some questions that have been successful in other jurisdictions. So, they're being able to share their stories with others just in trying to form some of those questions. We've been working with the UC Davis National Sustainable Transportation Center, and we're going to be doing an ISIM Integrated Transportation Health Impact Modeling Workshop, actually at SACOG in a couple of weeks, because we need to hit these other sectors. We've been focused in planning, and there's only so much of us to go around, and so, but we really want to take advantage of this opportunity again with Dr. Woodcock from England being in town, and Dr. Maidlich, who's also done the work, to look at it and to bring all the transportation planners to the table. So now we've got Caltrans and the Air Resources Board and transportation planners and engineers and modelers and some of Olivia's epidemiologists are all coming to this workshop, so that now we can start moving health more into the transportation sector. The Sacramento Valley section of the APA planning series, the speaker series coming up, health is integrated throughout all of those series. So we're working on getting those presentations up to date. I'm sure you're talking about something a little bit longer term, and we're still, needing to kind of figure out what is that next thing, because the bottom line is that we can't get too far out there, because there's still so much basic information and education that has to be done right here in the very now. And so I think we're trying to work both ends, at the same time. We're still trying to find some champions within some of the different cities in the region that are willing to take this up and then permeate it through, spread it throughout the whole organization. Continuing to provide support to the planning directors and public health officers as they continue to convene. And frankly, we want to be able to use SACOG, as our council of governments, to really grow this even further across the region. When Monica was talking earlier about community involvement, we were so excited. We're just like, guess what? We're going to be embedding healthy communities into all the different planning policies and design guidelines. And we get this puzzled look from the resident, and they kind of go, "You mean you're not already doing that?" So we do have a lot of work to do, and not getting too ahead of ourselves, because there still is so much of the basic stuff that still has to be done, and the more partners we can bring, the better.
I think your comment about the residents, aren't they already doing that, is also really apropos to this issue of the integration or the crosswalk or the whatnot. We forget in the public sector as we go about our daily routine, and some of us are land use planners and transportation, public health, and et cetera, that real people don't live life that way. They don't think, okay, well, now I'm a walker, I'm going to the store, and now I'm a driver, and now I'm a parent and going to PTA. They're just living their lives, and it's incumbent on us who are trying to be public servants to figure out how to provide what we know how to do in a way that fits how real people think and act.
But there's a challenge. I just want to interject, because this is the rub. We make it look really easy. In fact, when we're getting ready, for this presentation, Joe says, you guys made it look really easy. Well, it really, it was and it wasn't. And we were very, very blessed, and still are, with the process. But here's some of the just basic rub kind of stuff. Is, you go into a project and it's some type of little industrial area, like a convalescent home or something like that. And the neighbors immediately want walls put up around. The sheriff's department wants walls put up around the project. Well, that totally cuts off that facility and those residents from the rest of the neighborhood. Never mind, it's not walkable, and all the greenhouse gas emissions and extra vehicle miles traveled and all of those things. And so those are still some of those relationships and some of those, speaking of walls, that we really need to break down. And it's like, okay, that's what we have SEPTED for. That's why, we have better design so that we integrate within our community. We don't continue just to go to the easy solutions that we've done for the last 50 years that have really separated us.
So that's a good example of, again, I'm harking back to an earlier couple of, both of you, Judy and Dr. Kassir, you've mentioned data and information and needing to develop more of that, so that's the here and now. We pay a lot of attention to that, as you know, at SACOG, and really try to have and share with our members and the residents of the region the best knowledge about cause and effect. If you do this, what's the impact likely to be? And this is a field that is still evolving in that area. There has been a lot of good technical research done to document what to most of us seems like common sense, that how you build your neighborhoods and how you build your streets and your other transportation modes, and what you decide to make easy and what you decide to make hard does influence how people travel. And how they travel depends on, influences how much time they spend in congestion and how frustrated they are when they get home from work, and it affects how much pollution goes in the air and how much carbon dioxide, warms the planet and all of those things. But I think we need to be honest and humble about the fact that this is an area that the specific science is still evolving in this area, and the more that happens, the better. The quicker this evolution, I think, will happen, the better kinds of decisions that we can make. Go ahead.
You've been asking us all the questions. Can we ask you one?
No. That wasn't the deal.
So how can our collaborative, how can all of this, how can others, how can the region effectively engage with regional government?
Right.
SACOG in particular, and our elected officials.
Right. Well, first of all, back to the point about using language, it's important to realize that the regional space, which is the SACOG in this case, is more a component of local government than it is a separate standalone government like the state of California or the federal government is. Those have their own directly elected representatives, congresspeople, the president, and at the state level, obviously, the governor and the legislators. SACOG is governed by the elected officials who were elected to be a city councilor in Placerville or Lincoln or Sacramento or Board of Supervisors in any of the 6 counties. And so, long-winded way of saying what you're doing is the way to start to do that, because you're working with all of our members. And we are, we work it very hard at being a bottom-up organization and listening very carefully to what our members' needs are and how, by working together, we can help them better meet their needs. To be a little more specific, the responsibilities that SACOG has include doing a long-range transportation plan for the region, 20, 25 years out, and the land use components of that plan. And then in the short term, making decisions about where transportation funds are going to be spent. How much on building new roads, how much on building complete streets versus freeways, how much expansion in the transit system do we need, and those sorts of things. And so where the analog to what you're doing with the design guidelines at the county and hopefully other local governments is that these issues need to get more and more embedded in our decision criteria as we put the long-range plan together and then as we make the short-range funding decisions. And we have made a fair amount of progress in that area over the last few years, but I don't pretend that we're where at least I personally think we need to be. And so I think the more you work with the local staff, local elected officials, and then keep the SACOG planning agendas in your mind and be, don't be scarce at the SACOG board committee meetings. And I think there's sort of a natural, healthy democracy works that way, right? It starts at cities and counties and it comes up to the regional scale. I will say this, as we sort of get to the conclusion of this, we've done a lot of work at SACOG over the last 15 years or so, say, on studying how this regional organism works. And when you put all the neighborhoods together in the cities and the counties and you have a regional land use pattern and airshed and watershed and transportation system, how does that really work? And how can it work in the future to serve the needs of the residents as optimally as possible? And one of our big conclusions is that how neighborhoods function is critical. And so I think this thought space that you're in with this marriage of land use, transportation, and public health is marries up really well with what we've concluded on the technical side of takeoff. You know, if we build more neighborhoods the way we built them in the 20s and the 30s and the 40s, the sort of the pre-World War II era in this country, where you have a mix of types of housing, you have, you know, the iconic images, the corner drugstore and the public park and the church and the school to walk to from your houses. You have front porches, and so you have lots of social interaction, which is an aside is where I think the next level of this health conversation is going to go, is to how the built environment affects social well-being. Because there's a fair amount of research about that as well. We've been talking about the medical here, but I think I suspect that's where this field is going next. So am I answering your question about how to engage at the regional level?
You are, and we'll work with the 70 public health officers and work on some presentations to bring to the board and continue, you know, to grow our meetings with the different jurisdictions and the electeds.
Yeah. I think you'll have a friendly reception. Okay, we are coming down to the end of this, and so I want to give each of you a brief opportunity to just put a thought or two closing remarks. And so you can say whatever you want, but if you don't know where you want to go, think about the long term. And if the trajectory of this good work continues to build, where are we going to be 20, 30 years from now? How will we know that things are different because of efforts, integrating efforts like this?
Well, I've said all along that put us out of business, that there is no longer a need for Design for Active Sacramento or our cross-sector team or the work that we're doing, because it is already so ingrained in what everybody else is doing. We're out of a job. So there you have it.
That's going to be tough to beat, Monica.
Yeah. It is, and it's kind of related, but I've been kind of thinking about this. And so what I would challenge us all to do, and those who are getting ready to dip their toe into these types of efforts, is to be fearless and to be bold. Don't be afraid to ask the question because you don't understand the language of your public health officer. Pick up the phone, step out of your office, go into the community, talk to people walking down the street, understand that. And while we focused on planning and health at the local level, think about how you integrate your first responders, law enforcement, parks and recreation. These are all contributors to health in the built environment. And while there is the health benefit, there is certainly an economic benefit for employers and schools and hospitals and healthcare providers. So this is, we've just kind of scratched the surface today on who benefits besides just the residents with improved health, better air quality. There's so much more here on this conversation, and so I just challenge people to go have those conversations and keep pushing.
And I think for me, it's given me a different way of actually talking about chronic disease and the public health impacts of that, and a way of actually empowering people in the neighborhoods to find ways of actually getting involved and making a difference. And the way that I think that I would realize that we have succeeded is a world where there's health equity, where your zip code does not determine how long you live, where your zip code does not determine your health, and where you have the ability to live as healthy as you choose.
Thanks.
Great closing. Mic drop.
Well, on behalf of of the Institute for Local Government and my colleague Julie Lee Johnson and myself, Randy Kitty, we are so pleased that we were able to convene here and have this important conversation and provide this dialogue to the participants who are able to join us today. We want to share with folks that this recording will be available on our Institute for Local Government website at www.ca-ilg.org. So we look forward to continuing this conversation. I think there's much more to come out of this dialogue, and we really appreciate each of you for committing your time today. Thank you, Mike, for moderating, Dr. Linda Kasseri, Monica Hernandez, and Judy Robinson. And I just want to share that the Institute continues its series on stretching community dollars with another webinar related to public safety and violence prevention. We'll be sharing the story of the Santa Rosa Violence Prevention Partnership. You'll be hearing from the elected officials and folks involved in that partnership firsthand, and that'll be this October. So we'll be sharing that with you and inviting you to participate on another webinar. We also invite everyone to check out the Institute for Local Government's materials and resources available online and complimentary. We have a variety of materials in each of our program areas. What you see here right now is materials that are for our collaboration and partnership section, as well as materials for our healthy neighborhood section. Thank you for taking those out and sharing with others. We also could not have done this webinar today without support and funding from both Kaiser Permanente and the California Endowment. We are very grateful for the opportunity to work in the sphere of health and neighborhoods in supporting positive outcomes, specifically around healthy eating, active living, violence prevention, and safety. And thank you to Kaiser and PC. And with that, following this webinar, we'll have a short survey, and we'll share all of the handouts and materials on our website, and we'll be sharing this broadcast with you as well. So if you have any questions, please email me. I'm happy to respond. And just again, thank you to each of our panelists.
Thank you.
Thanks.